So prior to right now, we have drawn our patient's blood, we've spun it down, and I have her platelets concentrated in a few syringes. And we are going to inject those platelets into her breasts. So that way, over the course of the next 2 to 4 months, she could potentially go from a B cup to a D cup, or she could get lift, or she could get both. So like I said, I have some platelet-rich plasma right here, and I am going to start injecting. I'm gonna have you turn your head to the side. And she had numbing cream on her before, and so I wiped it off and already cleansed her with antiseptic. All right, and we're gonna start right here. 1, 2, 3, here we go, la la la. And now we're going to inject. So we inject her along the cleavage area, and it is a pretty quick, procedure. If you have nipple insensitivity, it can help with that as well. But the platelets are going to signal to her stem cells to migrate to where we are. And then her stem cells will come over and they'll go, oh, I'm in the breast, I'm gonna make more breast tissue, which is basically adipose. You can do this even if you've had implants, especially if you've had your implants out too and you have sagging breasts now. So there's lots of different reasons why. Look at how, that is beautiful. Nice. Okay, let's go to the next one. So this is still PRP. Are you doing okay?
Mm-hmm. Yeah, doing great.
Good. And so we're going to inject a little higher now. 1, 2, 3. Here we are. La la la. And we are going to inject some more platelets. And like I said in the beginning, turn your head a little farther for me.
Mm-hmm.
It does take a little while to see the full effects. Platelets don't work that fast, but they do work. There we go. You doing okay? You feel all right? Okay.
Mm-hmm. Totally.
Okay. And we're just distributing them up here. A little bit more left. We draw about 120 cc's of blood. So less than what you would do if you were giving blood. Hold on, one more. You okay?
Mm-hmm. Mm-hmm.
All right, I'm just gonna keep on distributing, and good. Okay, perfect. And now we're going to do platelet-poor plasma, because although platelet-rich is where it's at, there's still some platelets in the platelet-poor, so we might as well use it. So we're gonna just keep on going along. Ready? 1, 2, 3. Hi. Hello, hello. And it may be a little bit spicier than the other. Does it feel okay?
That was just fine, yeah.
Okay. Awesome.
Mm-hmm.
All right. And really, there's no contraindications to doing PRP for breast lift, or really PRP anywhere. Of course, if you have a low platelet count from an underlying disease, you probably wouldn't do PRP, but you would know that. And there's no downtime from this procedure. That's a really nice thing. You don't need to wear a garment or have any drains. You don't need anybody to drive you home after doing this. It's all just easy. You might have some bruising. Sometimes people can, but sometimes you don't, like this time right now. So that's good so far. Now I probably just jinxed ourselves, but look at this. I always say bruises are complimentary, but
Mm-hmm.
I always try to make myself laugh too. Okay, turn a little bit onto this shoulder. Like bring that shoulder. Yeah, there you go. Perfect.
Mm-hmm.
All right. So just another little bit. I'm going to get in here. There we go. So afterwards, I usually tell the patients, keep the girls high and tight. You're going to want to wear a sports bra, maybe 2 if you're going to work out.
Totally.
Just because they'll be sore, because
Yeah, generally. Totally.
I've just poked you a bunch of times.
Totally.
Let's go one more a little lower. One more right here. Hi, here we go. La 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 la. You okay there?
Oh, totally. Yeah. Doing good.
Let's
Just
see
fine.
here. Let's go down lower. Okay, awesome. And then let's go a little bit. We're going to go just a little bit. And it's right up in here. Ready? One more time. La 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 la. All right. Okay. You okay?
Yes.
Okay. Well, we'll be done with this breast in just a sec. PRP has been used for a long time by orthopedists and dentists. There we go, all done with that breast. So this is nothing that's really new. It's a little newer in the aesthetics world, but tried and true. So look at that difference. Isn't that beautiful? Yeah. All right, so I'm going to wipe her off, and then we'll come back in a sec to do the other side. Right, now we are on our other side, so we're going to go ahead and inject the platelet-rich plasma again. 1, 2, 3, but now it's on this side. So here we go. PRP, beautiful. And so when she walks out of here, she's going to have bigger breasts because there's going to be a lot of fluid in there. And then in 3 to 4 days, she's going to be like, oh, where did it all go? Because her body is going to absorb it. And then and that's when her body starts recruiting those stem cells over, and the stem cells start working their magic. So in about anywhere from 2 to 4 months is when we start to see the results. And actually one of our patients just came to me after 1 month, and she told me that she was already loosening her bra straps after just 1 month, and she had bought these bras that were too big for her, and after 1 month she was filling them out more. So that's very exciting. Okay, ready again? 1, 2, 3. So I don't want to promise quicker results like that to everybody, but you know, it does happen, so that's good. The quicker the better, right? This can last you, I usually tell people, you know, repeat it once a year, maybe every 18 months, but you'll know when you see, you know, your breasts, maybe they are not as perky or as full as they were over the past year, then do it again. Sometimes people come back in a few months and they're like, I love it, do it again now. So, you know, there's no limit as to how many times you can do the breast lift, but I know it can last for a number of years too. If you do it. If you do it just once even. Okay. And then oftentimes we'll combine PRP with Scarlet, which is our microneedling radiofrequency device. So we would Scarlet first to tighten the skin and lift the skin up. Then we would do PRP. After that, you can actually add PDO threads to give even more lift. And if you really wanted the quadruple threat, you would start with Scarlet to tighten the skin. You'd put filler in to give a fullness immediately that lasts for up to a year. Then you put the PRP in, and then you do PDO threads. So there's lots of different things we can do for the breasts, depending on what your goals are. Ready? 1, 2, 3. And if your goal is no surgery, that's great. And some people do need surgery, not need, so some people still, you know, to get the results that you are desiring, might decide on surgery, you know, but this is a great alternative, as I don't particularly care for undergoing anesthesia and all the risks associated with that. So this is the platelet poor plasma. Here. Continuing. So nice to see the breast just plump up. I love it. I'm doing great. Are you feeling okay under there? Yeah,
Oh, totally.
Okay.
Yeah.
Awesome. Other functions for PRP, you can inject the scalp for hair loss, for hair thinning. You can inject into the vaginal area for urine incontinence as well as for sexual wellness. You can inject penises for the same erectile dysfunction as well as urinary incontinence in men. You could inject the face and use it like filler. If you're afraid of filler and you want to see what filler would look like, we can easily do PRP injections. You'd be able to see what it looks like, and then it would recruit stem cells over to make more collagen, elastin, and fibrin in the areas that we treated. And then you could do the vampire facial. Turn onto this shoulder a little. During which we microneedle platelets in. 1, 2, 3, hi. Just a couple other little spots here. And is this hurting you?
No, no.
Okay. Awesome. Good answer. Good answer. Mm-hmm. Yeah. Mm-hmm. Let's turn and go this direction a little bit. Okay, coming out. Okay, let's go down a little. Oh no, not you. Go back over here. Yeah. I'm going down a little bit. Ready? 1, 2, 3. Hi. Sorry. Do a little down here. A little bit of oomph everywhere, right?
Mm-hmm.
You okay?
Yep.
Okay. I'm gonna come up over underneath here too. 1, 2, 3. Here we go. We have a lot of platelet-rich plasma here. So. Some angles are a little bit better than others. We don't use other people's blood. We only use your blood. We've had that question asked. If we could use somebody else's blood. The answer is no. We like to use your own. We only use your own. What else? I don't know. I think those are all the questions I usually get. But we have a nice pre and post care, so that way if you needed to, you can refer to them online. And we have a little bit more of the platelet. We have a little bit more of the platelet-rich plasma, but we're going to end up sitting her up and figuring out where we should put it. But you can see how nice that breast looks now. It's just beautiful.
Yeah.
So if you enjoy the video, please share it. Find out more on RejuvenationMD, medspa.com, and most importantly, come and see us.